His family hangs a huge celebratory banner at Garrick Market today. His sisters stay up, making the banner to embarrass him with bright colors. His older sister comforts him, while the second sister teases him mercilessly. Their joking is broken as the father announces a big discount in good mood. Recalls a legendary surgeon's words that inspired his dream to become a doctor. The legend said great surgeons need hawk eyes, woman's hands, and a lion's heart. As a student, MC failed exams. His father doubted his talent but never gave up. Father recalls MC's childhood skill with knives, encouraging him to keep his stubbornness. MC insists he will become a doctor, even if it takes many tries to get into medical school. He barely passed medical school after 3 tries, beginning a tough journey as an intern. At dinner, family and brothers-in-law ask MC about his Yun-Guk University internship. His brothers-in-law bring out exotic health foods to toast MC's future success. Father proudly unveils a frozen golden tuna eyeball as a gift to MC. Family shares the fisherman's legend about the golden eyeball curing blindness. Sisters doubt the story, while father prepares a toast with the eyeball liquor. Toast to his future, MC endures the bad taste without protest. Brothers-in-law present exotic health drinks and roots while MC reluctantly accepts. The strange foods cause MC illness, but he gains an unknown power afterward. He finds himself in a dream. The world around feels like faded watercolors. Dream world feels like an old faded film, edges blurred and colors soft. He notices the dreamscape is strangely silent, enhancing the eerie calmness. He senses this dream is unusually vivid, far more real than before. Faint light shines far away, drawing his gaze forward and sparking curiosity. As he approaches, the light slowly shapes into a figure standing silently. The glowing figure remains silent, radiating a calm but inscrutable presence. He feels a strange pull to follow the glowing presence deeper into the dream. He walks on, uncertain but compelled, deeper into the fading colors around him. The dream shifts subtly, shapes and colors blur like a fading memory. Suddenly, the dreamscape dims as cold shadows creep across the colors. He braces for change as the dream's palette darkens and tension grows. The dream's gentle calm fades. Something unseen moves nearer and threatens him. Suddenly, he wakes up, gasping as the surreal dream fades quickly away. He finds himself safe but confused, unsure where dream ends and real begins. He rubs his eyes, trying to shake off the lingering dream's vivid grip. He stands to leave his room, mind still swirling with strange dreams and unknown meanings. His dream leaves him unsettled, a mysterious whisper from a fading world. He faces Kim Viper, who teases him about his failing university background. Kim Viper warns MC that adapting here won't be easy coming from his university. Promises to survive and grow beyond all expectations despite their doubts. Kim Viper mocks the low chance MC can be intern of the year here. Jo Jin Gi, a hostile intern, sneers at MC and mocks his errands. Jo Jin Gi clings to Kim Viper and whispers secrets about other interns. Left alone, MC cools his anger and tries to control his rising temper. The head nurse approaches and offers sympathetic words about academic elitism. MC accepts the nurse's encouragement and resolves to endure the harsh environment. He packs sandwiches and prepares for the demanding morning conference ahead. Alone, he inhales the cold air in the empty, spacious conference room. He admires doctors-patient discussions, reminded why he chose medicine. Lee Yun, SEO, surprises him, handing a throat lozenge with a warm smile. He warns him about dozing off during conference, stressing professors watch. MC thinks of survival and focuses on adapting to harsh intern life here. Their talk is interrupted by others, greeted loudly as more arrive. Conference starts. Doctors discuss patient care while MC listens quietly. He notices the professor mentioning patient Kim Jong-soo undergoing treatment today. His mind flashes back vividly to the dream about patient Kim Jong-soo's death. The MC watches himself performing CPR in a vivid dream at the hospital. Electric shock fails. The patient's death is declared after a long resuscitation attempt. The MC solemnly reflects on the unavoidable loss and his feelings of helplessness. MC wakes up from the dream in the hospital cafeteria, sharing a breakfast with colleagues. They joke about MC falling asleep while eating and the toll of intern work stress. MC explains his strange waking dream state feels unlike normal sleepiness. Gun Wook jokes about narcolepsy. MC denies and cites intern fatigue instead. The interns laugh and complain about the tough intern life and constant exhaustion. MC's pager rings with a patient emergency call for chest pain in room 1705. He rises quickly, preparing to attend the cardiac emergency without delay. Colleagues whisper about MC's hard work and his background with with mixed feelings. MC ignores the muttering, focusing on his mission to work hard as his own self. MC climbs to the first floor lobby beneath a bright high ceiling, heart full of pride. Thinks about the hospital's prestige and recalls his family's pride on his success. MC enters the elevator, inspecting his reflection and checking his ID card. At the ward, MC greets nurses who comment on his fatigue and charm. Nurses joke about MC's dull complexion and his potential as eye candy. MC logs in to check urgent tasks and prepares an ECG for a chest pain patient. He notices atrial fibrillation on ECG and informs the nurse about it seriously. Resident Dr. Kim Soo arrives, inspecting the ECG with a sharp critical gaze. Kim praises MC for thorough preparation but mocks his university origins sharply. Stares at patient data, shocked by the scheduled coronary procedure. Doctors stare coldly as he mutters aloud, raising tension in the room. He recovers and feigns interest in the PCI, easing the professor's suspicion. He tells himself to stay calm and ignore impossible thoughts about precognition. He helps Yun, SEO, by taking over some consent forms so she can eat. He notices the patient's name, Kim Jong-soo, matching his earlier dreams. He enters the patient's room and is stunned by the man's familiar appearance. He explains the procedure carefully to the patient and his worried daughter. The daughter worries about risks, pointing at concerning sections on the consent form. He reassures them gently, explaining low risks and expert care at the hospital. He watches them hold hands, a reminder of his own family bonds. After hours, he returns to the dorm, exhausted, as Gun Wook works out nearby. They joke about muscle loss amid tough duties and the long hospital nights ahead. Gun Wook warns about March accidents as MC prays for a quiet night shift. MC studies late. Gun Wook yawns and heads to bed, snoring loudly above. MC gradually falls asleep from exhaustion while Gun Wook's snores fill the room. The emergency alarm blares. MC wakes sharply and rushes out with Gun Wook. They hurry on their gowns, bumping into furniture while rushing down the hall. They rush to the emergency, ready for CPR and the battle to save a life. MC and Yun, SEO, rush through the hospital halls toward the emergency. They meet Kim Viper, who sternly scolds them for being late to the emergency. Interns quickly organize into roles, preparing for chest compressions and ambu bag use. MC notices the patient's familiar face during ongoing CPR compressions. Shock restores the patient's heart rhythm before MC's compression turn arrives. Kim Viper quizzes the interns fiercely on CPR guidelines and procedures. MC correctly answers Kim Viper, who nods slightly, showing rare approval. Interns leave after Kim Viper's reprimanding, tension easing slowly. Back at the dormitory, they joke about the night's tension and Viper Kim's harshness. MC feels a growing unease and decides to return to the hospital's west ward alone. Yun, SEO, catches up and insists on accompanying MC to check the patient again. They arrive again at the patient's bedside, where the ventilator hums quietly. They check patient's vitals, hearing the steady beeping of the heart rate monitor. MC questions Yun, SEO, about the patient while they observe him silently. Yun, SEO, shares her brief encounter and the smell of smoke near the patient. MC studies the patient's chart showing severe health risks including smoking history. Yun, SEO, reacts with concern seeing the severe cardiac condition and risk factors. MC explains the PCI procedure and risks associated with implanted stents. MC tries to recall medical details as anxiety grows over patient's fate. Suddenly, MC recalls the term refractory ventricular fibrillation, a dire sign. MC points to ECG showing abnormal beats. Yun, SEO, looks on uncertainly. MC urgently tells Yun, SEO, the patient is in danger and needs immediate help. MC plans to warn Kim Viper despite fearing his harsh reaction. Kim Snake scowls at the intern's daring opinion during tense exchange. Kim Snake mocks the intern for daring to lecture a senior resident. MC suggests ECMO could be needed for the patient despite senior scorn. Kim Snake ridicules ECMO knowledge as mere news, not real practice. MC counters that preparing for the worst is necessary in critical care. Kim Snake reluctantly admits foresight is needed in difficult cases. Kim Snake calls thoracic surgery to prepare ECMO, emphasizing the intern. Kim Snake decides to move patient to ICU while sarcastically warning intern. Kim Snake leaves after warning Yun, SEO, praised intern's boldness. Yun, SEO, explains hospital seniors' reputations, finds interns act cool. MC decides to watch patient longer, feeling uneasy despite relief. Yun, SEO, insists on staying to watch patient alongside determined intern. Night deepens as MC and Yun, SEO, endure fatigue, patient's vitals steady. Yun, SEO, accidentally hits MC's shoulder, together, breaking tension with humor. MC urges Yun, SEO to rest, but she insists on staying by patient's side. Suddenly, alarm blares signaling ventricular fibrillation. Chaos erupts. CPR begins. Kim Snake takes lead, switching hands forcefully during compressions. Electric shock fails to restore heart rhythm. Patient turns gray. Hope fades as patient fails to respond. MC doubts if future can change. Thoracic surgeons rush in with machine, Hope returning to save the patient. Thoracic surgeons rush in with ECMO, preparing to save the critical patient. Song-yu Ju calmly leads ECMO insertion, spreading the drape with steady hands. Song-yu Ju inserts needle to find vein confidently despite patient's shaking. Guidewire advances smoothly into inferior vena cava under ultrasound guidance. The less experienced resident inserts artery needle with Song-yu Ju's calm guidance. Song-yu Ju orders interns to stop compressions to check syringe blood flow. Guidewire slowly inserted with warnings not to force or damage blood vessels. CMO turned on and running well. Doctors breathe sighs of relief. MC and Yun, SEO catch their breath as tension slowly dissipates after the crisis. Yun, SEO praises thoracic surgeons and admires senior Song-yu Ju's skill. Hence Kim Viper enters pale, breaking up MC and Yun, Seo's chat with sharp words. Kim Viper warns MC to not be arrogant despite his lucky timely call for ECMO. Kim Viper hesitates, then offers MC a drink, softening the harsh moment. Yun, SEO laughs, teasing MC that Kim Viper's favor is almost a love confession. Song-yu Ju updates patient records, knowing ECMO marks a new treatment start. Ma Dong, Sia praises Song-yu Ju's talent, recalling her outstanding intern days. They discuss unusual hard, working intern Shin Seon Han, surprising for a rookie. Song-yu Ju notes silently to herself how far MC has come for a fresh intern. MC starts a busy day, running errands across hospital wards without break. Kim Viper softens tone, tells MC to eat and rest before next medical task. MC smiles slightly, appreciating softer treatment from Kim Viper after tension. MC debates between eating and doing enema, chooses rest to avoid nausea. MC and Gun Wook go outside the hospital to clear their minds in fresh air. Yun, SEO approaches, playfully hitting MC's broad back. All enjoy moment outside. MC asks Yun, SEO about patient Kim Jong-su's condition after surgery. Yun, SEO reassures MC patient Kim healed well. MC breathes out relief. MC and Gun Wook decide to cheer up by visiting a nearby pub after shift. Yun, SEO gathers many intern classmates quickly at the welcoming fusion pub. Jung Won-hyung leads lively talks, sharing struggles being an older intern. Jung Won-hyung jokes about seeing Yun, SEO, breaking ice among interns. Yun, SEO praises MC as ace intern, sharing heroic patient story to crowd. Jo Jin, GI drunkenly mocks MC's chances due to his local school background. Jung Won-hyung ushers away drunk Jo Jin, GI to sober him, easing tension. Jung Won-hyung advises MC to ignore drunk insults. MC smiles calmly. MC reflects on hospital life, weird colleagues, and recent drunken hostility. MC's vision darkens suddenly. A new future vision begins to unfold. MC's vision blurs, revealing a scene like an old film reel again. Turns discuss Jo Jin, GI's drinking, jealousy over Yun, SEO causes conflict. Jung Won explains Jo Jin, GI's jealousy after repeated rejection by Yun, SEO. A rumor says Yun, SEO, and MC might be seeing each other in the hospital. MC feels absurd but realizes Jo Jin, GI's attacks are pure jealousy. Interns put out cigarettes. A loud voice interrupts from the pub inside. Jo Jin, GI falls down pub stairs, drunk, wailing at the bottom loudly. Interns decide to call a taxi, help Jo Jin, GI into it, concern clear. MC returns to reality, glass of alcohol untouched, atmosphere unchanged. MC steps outside to clear his head, contemplates the irregular precognition. MC notes the repeated future event playing out word for word again, chills rise. MC and Jung Won discuss Jo Jin, GI and deny any romantic link with Yun, SEO. MC urges interns to downplay rumor. Jung Won agrees to understanding. Loud voice inside pub calls out. Chaos ensues as Jo Jin, GI falls downstairs. MC learns Jo Jin, GI's wrist is shattered. A cast for a month is required. Wook laughs about Jo Jin, GI's ruined internship and the hospital rumors. MC contemplates his new ability, unsure whether to intervene or stay passive. MC writes rules about precognition, timing irregular, future changeable by actions. MC resolves to enjoy the strange power and accepts its unknown limits humorously. MC jokes aloud for lottery numbers but gets no answer but silence. Final day in internal medicine, MC bonds with elderly patient before departing. MC draws patient's blood gently, praised for his soft, skilled hands. Patient laments MC leaving, jokes about marrying her granddaughter someday. After farewells, head nurse approaches quietly as MC leaves the hospital room. He receives praise for his excellent blood drawing skills from the head nurse. He learns procedures impact patient outcomes and recognizes his own limits. Kim Snake awkwardly asks MC about food for the farewell dinner. Kim Snake's tone grows annoyed while pressing MC to pick the dinner cuisine. MC suggests steak, which calms Kim Snake's anger and eases tension. Kim Snake jokingly warns MC to be ready for hard work in new departments. After the farewell dinner, he walks alone in spring rain, pondering life as a doctor. Yeobong Cheol struggles managing the chaotic emergency room workflow today. Frustrated, Yeobong Cheol scolds interns for being slow and inefficient. Late at night, he slumps exhausted in the on-call room wishing for relief. The chief comforts Yeobong Cheol and shows him the difficult intern list ahead. He reads the intern list, shocked by the poor reputations of many names. Cheol scolds Jojin Gi Ojung 1, Hamso Dam, and Shin-sun Han harshly. He states the intern group looks like Avengers sarcastically, frustrated by them. MC braces himself, ready for new struggles and challenges in emergency medicine. He faces bleak team members for brutal emergency medicine duty shifts ahead. He meets rough but honest resident Yeobong Cheol in the hospital locker room. Yeobong Cheol warns him to avoid cluelessness and do his part well here. Early morning, he confronts Jojin Gi's awkward avoidance in the quiet conference room. The four interns gather early with snacks, each showing distinct personalities. Yeobong Cheol scolds them jokingly about bringing Fanta and patient overloads. The team laughs awkwardly as Yeobong Cheol's scolding lightens the tension. Hamso Dam introduces herself in the morning conference, seeming stiff and uneasy. Oh Jung Won respectfully introduces himself, noting his age amid quiet reactions. Jojin Gi appears embarrassed as he explains his injured hand to the group. He introduces himself simply, noticing the cold focus on Hamso Dam's royal status. Yeobong Cheol reminds interns to do more than hard work, urging quality over effort. Yeobong Cheol leads the interns for an emergency room briefing after introductions. Yeobong Cheol asks if they know what an apocalypse is, hinting at the ER's chaos. Oh Jung Won replies with a vivid description, confirming the apocalypse concept. Yeobong Cheol welcomes them to the emergency room apocalypse as the door opens. The emergency room is crowded with diverse patients of all ages and symptoms. Dr. Yeobong Cheol carefully examines symptoms and gives clear diagnoses. Yeobong Cheol assigns interns simple patient cases to attend as primary contacts. He explains procedures and directs us through various cases urgently and clearly. The shift workload appears overwhelming as the emergency room fills rapidly with cases. Yeobong Cheol organizes assignments and warns interns not to compete unnecessarily. MC and Sodam work tirelessly treating wounds, drawing blood, and assisting in procedures. After hard work, MC and Sodam have a quiet yet awkward cafeteria moment together. Sodam admits to hating emergency room work but tries to open up to MC. They share a quiet moment as Sodam timidly asks to try some shrimp tempura. Yeobong Cheol reviews intern evaluations, weighing skill and sincerity critically. He marks Jojin Gi poor due to injury and questionable effort during shifts. Oh Jung Won earns a decent grade, showing quick reflexes and able work. Ham Sodam presents difficulties with skills and confidence as an intern. MC shows high sincerity but remains awaiting assessment of other abilities. He reminds the interns, do not cause accidents or risk losing progress. During a busy second week, MC juggles difficult tasks as chaos grows. MC and Jojin Gi handle continuous tasks with growing pressure and workload. Hyung Jung Won encourages the team as tension rises to keep focus on tasks. A loud disturbance erupts in Area A, instantly shifting emergency room attention. Tension rises as a guardian shouts angrily at So Dam in the ER. Jojin Gi mocks So Dam for failing a basic arterial blood gas test. MC steps forward calmly to comfort the angry guardian and frozen So Dam. MC soothes the guardian, explaining the difficulty finding blood vessels. MC gains the guardian's trust while asking the patient to remain still. MC MC examines the swollen wrist from So Dam's attempts, feeling nervous. MC asks So Dam to confirm which arm she tried first to understand the injury. MC recalls how to perform ABGA with pulse palpation for deep arteries. MC instructs Guardian to hold wrist firmly to stabilize for blood draw. MC encourages patient to be calm for the difficult arterial blood puncture. MC inserts needle carefully, hoping to find the artery on the first try. Bright red arterial blood finally fills the syringe. MC feels success. MC finishes the procedure. Patient and Guardian show visible relief. The Guardian praises MC loudly and admires his skill and kindness. Dr. Yeobong Cheol compliments MC but warns next time use ultrasound. Yeobong Cheol warns to protect So Dam from becoming a workplace pariah. Yun Seo shares concern about So Dam's hardship and bullying. Yun Seo explains So Dam's past bullying and growing isolation. MC admits he's busy but offers minimal help for So Dam's struggles. Yun Seo worries aloud about a serious mistake So Dam might make. MC feels a sudden darkness and sees a new troubling future beginning. The interns gather anxiously as the chief announces all evaluations are C this month. Chief explains a major mistake caused a lawsuit, angering the whole hospital. MC suddenly wakes, startling Yun Seo with a shout about the dream's missing details. MC makes an excuse and quickly leaves, trying to suppress the chaos of his vision. MC fears he might be the one to cause the accident in the emergency room soon. Jung Won takes a break and warns MC to contact him immediately if anything happens. Jo Jin Gi follows Jung Won, joking despite wearing a cast on his hand. MC reflects suspiciously on So Dam, feeling she might cause the critical future mistake. MC offers So Dam support, encouraging teamwork to prevent fatal mistakes. So Dam laughs for the first time hearing MC's personal story behind his name. So Dam arrives early motivated, ready to prove herself and help in the emergency room. So Dam carefully offers to help nurses with patient care, eager to contribute. So Dam is assigned to care for a male patient with a urethral stricture. MC worries about the upcoming accident and plans to stay alert among all interns. MC steels himself to face the uncertain future despite the pressure of possible failure. So Dam, feeling motivated after MC's words, begins a fresh day with renewed confidence. Sodam recalls Ban Jinho's name and grows motivated to handle the case. She learns the patient waits long and feels compassion for his pain. Sodam commits to handling the patient's care herself confidently. She prepares catheterization tools, ready to treat the patient herself. Sodam finds the patient groaning behind a curtain, confirming his identity. Ban Jinho complains of urgent bladder pain, nervously trusting Sodam. Sodam encourages Ban Jinho she will drain his bladder before urologist arrives. Patient reluctantly agrees to treatment by Sodam despite initial embarrassment. Sodam begins catheter insertion but meets resistance from stricture site. Catheter slips repeatedly. Sodam grows frustrated but perseveres carefully. Patient grows embarrassed as an involuntary erection causes new complications. Nelaton slips fully inside urethra. Urine gushes out uncontrollably. Both doctor and patient panic as Sodam struggles to retrieve catheter. Sodam calls urology for help. A crisis known as the Nelaton disaster unfolds. Next day, staff discuss Sodam's mistake and its shocks in the ER. Sodam feels crushed. MC contemplates how to support her recovery. She doubts her abilities, considering leaving patient care behind. MC struggles to find words, realizing advice might worsen her state. He offers to stay but Sodam asks for solitude to regain composure. MC resolves to gather information and formulate a plan for recovery. MC reviews his calendar, narrowing down the date of the accident to late April. MC clenches his fist, determined to change the future and survive his internship. MC and Gun Wook relax on a bench, sipping coffee and talking about dating. Gun Wook urges MC to go on a blind date with 3 flight attendants. Seo joins MC and Gun Wook, teasing MC about the blind date plans. Yun Seo jokingly chides MC for avoiding dating despite the fun of spring. Later, MC talks with Dr. Yeobong Cheol about work and dating in the ER. Yeobong Cheol jokes about needing someone to date while MC remembers Gun Wook's blind date. MC shakes his head, refusing to distract from hospital duties with dating thoughts. Suddenly, the emergency room phone rings, breaking the conversation with urgent news. Yeobong Cheol snatches the phone phone, asking about patients arriving from a major accident. He orders urgent preparation for 9 traffic accident patients arriving soon. Nurses quickly organize the resuscitation room and prepare for critical patients' arrival. Yeobong, Cheol commands interns firmly, urging them to act fast and focus. MC gulps nervously, feeling the weight of facing a major accident for the first time. It is the last week of April, the time when suddenly many patients flood the emergency room. Today is the day the accident occurs and the emergency room braces for the impact. Night pulses as reckless teens joyride in a stolen luxury Bentley. Teens laugh off the need for licenses, speeding faster despite warnings. Driver drifts over the center line in the rain, causing imminent danger. Crash. The cars collide violently, causing a chain reaction of accidents. Students escape dazed. A seriously injured woman slumps in crushed compact car. Panic spreads as students debate whether to report the accident or hide. Emergency team prepares calmly despite chaos caused by underage drunk driving. Yeobong, Cheol commands triage teams to prioritize critical patients arriving soon. MC and Sodam ready for trauma care. Jojin, Gi stays away, avoiding responsibility. Ambulance sirens wail as the first bloodied patient arrives at the ER in critical condition. Yeobong, Cheol orders immediate intubation amid dropping blood pressure and oxygen. MC and Sodam locate severe bleeding from the patient's torn arm wound. EM chief watches ultrasound while Yeobong, Cheol performs intubation procedure. Jung-won struggles clumsily with blood test. Yeobong, Cheol takes over a line insertion. Jung-won nearly drops syringe and rushes out to run the arterial blood test. MC calls out to Jung-won, sensing danger as tension rises in the ER. MC notices Jung-won Hyung panicking and decides to take over the blood test duty. MC carefully prevents blood clotting and hurries to the analyzer with the syringe in hand. MC discovers the analyzer still holds previous patient's test results, risking a fatal mix-up. MC returns to the resuscitation room with correct blood test results for the critical patient. Professor confirms internal bleeding due to low hemoglobin and orders urgent plasma and blood transfusion. Yeobong, Cheol commands portable X-rays to check the cervical spine, chest, and pelvis immediately. MC and Yeobong, Cheol stay close to patient during radiation exposure, ignoring risk to focus on care. X-ray images reveal pelvis fracture causing dangerous internal bleeding in the patient. Pelvic binder is applied and fluids are infused, boosting patient's blood pressure and pulse. Vitals stabilize. Yeobong, Cheol prepares for CT scan covering brain to pelvis after transfusion. MC and Ham-so-dam briefly share a sincere moment amid the chaotic emergency room hustle. Ham-so-dam boldly confronts a disruptive guardian couple, showing fierce determination. Ham-so-dam quotes emergency service law, causing the guardians to reconsider their threats. Yeobong, Cheol praises Ham-so-dam quietly after her confrontation, lifting her spirits. C returns to the busy ER and finds Jung-won calm and managing the workload again. Jojin, Ki returns to work early after cast removal, joking about his newfound freedom. MC senses unease recalling Jojin, Ki performed a risky thoracentesis procedure recently. C urgently calls out to Jojin, Ki, sensing danger in his recent actions at work. MC questions Jojin, Gi about possible mistakes during his shift today. Jojin, Gi defends himself, claiming to be competent and insulted by MC Stouts. MC presses Jojin, Gi about thoracentesis and post-procedure X-ray checks. Jojin, Gi admits not having checked the X-ray after thoracentesis, making MC uneasy. MC demands Jojin, Gi open the X-ray immediately after his admission of neglect. Jojin, Gi checks X-ray and spots unexpected fluid, confused by results. MC spots a pneumothorax on the lung opposite to where the fluid was removed. MC accuses Jojin, Gi of accidentally puncturing the wrong lung during procedure. Jojin, Gi remains silent and freezes, unable to answer MC's serious question. MC demands patient location urgently after grasping severity of mistake. MC rushes to patient's side, finding him struggling to breathe alone behind curtain. MC commands oxygen mask preparation while Jojin, Gi freezes, stunned by crisis. MC resolves to act fast and asks for 16G needle to treat pneumothorax urgently. MC hesitates briefly before pushing the needle into the patient patient's chest decisively. Air escapes from the chest. Patient's breathing slowly stabilizes with raised SpO2. Yeobong, Cheol arrives, shocked but immediately takes control of patient care. Yeobong, Cheol scolds MC for unauthorized emergency care but assesses recovery. Yeobong, Cheol begins chest air aspiration, instructing MC to assist with the valve. Patient thanks doctors quietly, showing relief despite the previous terror. Ma Dong, Seop arrives from thoracic surgery, intense presence beside Yeobong, Cheol. Yeobong, Cheol, and Ma Dong, Seop discuss patient handover before transferring care. Yeobong, Cheol calls interns for a stern meeting to address the error harshly. Residents interrupt meeting, demanding to know who caused the dangerous thoracentesis error. Jojin Gi is exposed as responsible for the X-ray side mix-up. Jojin Gi admits the mistake. No senior resident defends him. Residents angrily criticize Jojin Gi for mixing X-ray sides carelessly. Emergency and thoracic surgery departments clash over the mistake impact. Chief resident ends the meeting, orders Jojin Gi reprimanded later. Yeobong, Cheol warns Jojin Gi to keep a low profile for now. Yeobong, Cheol calls Shin Seon Han for a private talk after meeting. Yeobong, Cheol warns MC about his evaluation based on answers. MC admits unilateral decision made in urgent situation with hope. MC describes patient's low oxygen and urgency during pneumothorax. Yeobong, Cheol acknowledges MC's right action yet warns boundaries. Yeobong, Cheol orders MC to avoid autonomous decisions as an intern. Yeobong, Cheol reveals MC has highest score for the month's evaluation. MC feigns ignorance as Yeobong, Cheol jokes about scores discreetly. MC leaves after bowing. Yeobong, Cheol pretends no knowledge. MC breathes out relieved, reflecting on the long, exhausting day. MC clenches fist, proud of saving the patient and earning top grade. Yeobong, Cheol manages aftermath, reports incident to professor. Patient's guardian confronts Yeobong, Cheol angrily over the error. Patient defends the doctors, easing tensions with his family. Yeobong, Cheol, and Ma Dong, Seop share candid banter over coffee break. Ma Dong, Seop hints at MC's unusual skill and possible thoracic future. Yeobong, Cheol grows angry on hearing new Jojin Gi misstep report. Yeobong, Cheol storms out, determined to confront Jojin Gi forcefully. Jojin Gi faces harsh scolding from Yeobong, Cheol over a big mistake. Jojin Gi admits to missing X-rays during trauma alert, trying to explain. Yeobong, Cheol confronts Jojin Gi about his callous attitude towards patient care. Jojin Gi tries to excuse his behavior but Yeobong, Cheol remains disappointed and harsh. Yeobong, Cheol announces Jojin Gi will receive the lowest intern evaluation score this month. Jojin Gi complains unfairly, comparing himself to Ham so damn's worst mistakes. Yeobong, Cheol scolds Jojin Gi about responsibility and true actions after errors. Yeobong, Cheol calls Jojin Gi a 0-point doctor despite his university reputation. Jojin Gi remains silent, accepting his harsh judgment from Yeobong, Cheol. Yeobong, Cheol advises Jojin Gi to reflect and improve during upcoming rotations. Jojin Gi feels frustrated and blames MC Shin Seon Han for his troubles. MC receives a scolding text from second sister urging him to come home sometimes. MC groggily agrees to visit home, admitting he's too tired to do much outside. MC boards morning bus after shift, resting his head against window, watching city pass by. MC arrives home. Older sister warmly greets him as family gathers for meal. Second older sister teases MC, playfully pinching his cheek in casual home setting. MC visits father working in room, who listens to trot music and smiles at his arrival. Family teases father's new trot music interest with playful laughter and chatter. Family shares a quiet meal together with laughter, fruit, and TV at their modest table. Second sister teases MC about hospital news as familiar building appears on broadcast. The arrogant couple causes a scene on the news, sparking public outrage. Couple owns a famous food company and faces backlash after a viral video. MC tells his sisters the couple caused trouble at the emergency room. The sisters debate about the parents' rude behavior and its consequences. MC naps but gets scolded by his second sister for sleeping the whole day. Second sister kicks MC's side, urging him to get up and move on his day off. MC debates getting exercise to recover after a tough stretch of hospital work. MC's phone rings, showing Muscle Bro's name, sparking his curiosity and concern. Muscle Bro's voice sounds serious, but the issue is a cancelled blind date trio member. MC offers an indifferent solution: attend without the third person on the blind date. Gun Wook resists but offers MC a tempting one-on-one training as a deal. MC agrees to training, seeing it as a refreshing break from hospital monotony. Gangnam Station, MC meets Gun, Wook and Jung-won, both awkwardly dressed. They laugh at each other's fashion mistakes, bonding over their shared discomfort. MC takes charge and quickly shops for new clothes to save their blind date. Their new outfits drastically improve their appearance and confidence for the date. Three men prepare to meet the women, tense but hopeful for the blind date ahead. Two brightly dressed women arrive, catching the men's full attention instantly. They agree to go to a bar with good atmosphere. MC senses the night will be fun. Wook asks MC to create a good atmosphere. MC promises to stay calm. MC resolves to enjoy the night and forget the hospital stress, though feeling uneasy. The group begins their first awkward conversation at the bar face-to-face. Names spark laughter, making the first impression among them surprisingly good. Jung-won smoothly takes over, suggesting everyone start with a drink cheerfully. Glasses clink as the cheerful group toasts and bonding begins over drinks. Names and work stories spark curiosity and laughter among the interns from different fields. Yoon-wook's innocent question about crew rest sparks laughter from the women. Flight attendants share their hard truth. Bonding forms between young professionals. The women ask about doctors' night shifts, sparking admiration and laughter. Jung-won exaggerates hospital stories, captivating the women's full attention. MC steers conversation away to keep the fun going, raising a new toast. Group's laughter grows louder after drinking, and the mood stays high. The drinking game begins, breaking the awkwardness with jokes and laughter. Jung-won reacts jokingly to a challenge, sparking playful rivalry and laughter. MC casually admits a crush, heating up the atmosphere with a playful challenge. Women head to the restroom. Men discuss their favorite among them with smiles. Men name their favorites and tease MC to consider his feelings for Sujin. MC deflects interest in dating, focusing on work while enjoying the night. The group plans the second round as time passes, continuing their excited chat. MC suddenly feels uneasy as his vision blurs and time seems to slow. Flickering images fill MC's mind. A grim accident caught on a news broadcast. MC confirms the accident is elsewhere, not at their current bar location. Emergency keywords flash in MC's mind as he searches for a deeper understanding. Women's voices pull MC back. Sujin notices and asks if he's alright. MC hides his worry behind a smile, pretending to be fine with friends. Friends tease MC about being weaker, revealing their playful side in the group. MC notices Sujin tugging his sleeve, inviting him to slip away from the group. Sujin confesses her feelings honestly, while MC feels conflicted and surprised. MC honestly rejects Sujin, admitting he isn't ready for dating yet. Sujin tries to tempt MC, inviting him to enjoy their night together. MC feels temptation but remembers the urgent reality awaiting him outside. MC excuses himself urgently, deciding to leave Sujin behind for the accident. Out on the crowded streets, MC searches urgently for the accident location nearby. MC recalls the dream's details, spotting star coffee signs to guide his search. Frustrated by too many locations, MC picks a nearby bar to explore first. At a bar terrace, workers worry over a shaky railing but do little to fix it. MC runs faster through the crowded streets, exhausted but determined. MC calms himself by recalling a surgeon's advice to never panic under pressure. He narrows his search to 3 alleys, planning carefully despite time pressure. Using Street View, MC finds a match and resumes running with hope. Yoon-wook calls out to MC for urgent help as something terrible unfolds. A terrifying crash occurs as the 3rd floor terrace collapses down below. MC calls out loudly, pushing through crowd to reach the injured people quickly. He announces he is a doctor, preparing to provide urgent help to victims.